Breast cancer has always been one of the leading causes of death among women. But now, better methods of detecting breast cancer at earlier stages have dramatically increased survival rates. Dr. John Craig of St. Jude Medical Center in Fullerton explains.
Breast cancer is a malignant tumor that starts in the breast and today produces a certain degree of anxiety since it's reasonably common amongst our population, especially in Orange County. And there are good screening tools and treatment tools available. So as a physician and director of a cancer center, my interest is in coordinating these numerous subjects of how to recognize breast cancer, how to diagnose it, how to counsel patients with the numerous aspects of the detection and treatment of the tumor. There is a national or statewide cancer surveillance program operated by the state, and cancer is a reportable disease in the state of California. And all the hospitals really participate in reporting that disease. And so there are statistics gathered. And Orange County is one of the one of the highest rates of breast cancer of all the states, all the counties in the state of California. The risk factors include states with high estrogen levels, namely that if a lady is pregnant quite a bit, her estrogen levels tend to be lower. So pregnancy is protective, so to speak. And yet there is interest in how long is a lady menstruating. So a lady who has very long menstrual history, early menarche and late menopause, would have lots more estrogen exposure. And so those are some of the risk factors. In addition, there's the problem of obesity. Obese women have slightly increased estrogen levels. There's interest in what does exercise do with breast cancer. There's a suggestion that exercising and abstinence from alcohol and abstinence from cigarette smoking reduce breast cancer. My wife is a breast cancer survivor, and she found a lump. And that created a certain degree of anxiety, and leads to examining the lump and thinking about it and talking about it, and then seeking a breast cancer opinion or from a physician with experience. Typically, one would go to a mammogram unit, could be by referral from your primary care doctor. In this case, it was from her primary care doctor. A mammogram was performed and it was normal. And this happens about 10% of the time that cancer is detected. So a woman is not completely off the hook. She must pursue this. And in this setting, because of the age that my wife was at, she was in the high-risk age group. Anything over 40 would be in the high-risk group. Ultimately, special studies were done and a fine needle aspiration, and cancer was thought to be likely, and then ultimately a biopsy was performed. So today, it's very common for many women, probably 60% of patients with breast cancer have what we call breast-conserving treatment, meaning the local cancer is removed rather than the entire breast. It's also quite common in selected cases to remove some lymph nodes as a means of staging and better determining the risk of future spread of the cancer. So I think today we've seen the broad acceptance of breast-conserving treatment. This usually also means radiation therapy is commonly applied. So now there's concern of what is radiation therapy and how does it affect my life? And often many of these ladies with breast-conserving treatment also undergo chemotherapy. My wife went through the entire gamut from fine needle aspiration, biopsy, wider excision, axillary nodes, chemotherapy followed by radiotherapy. So I've been down the road all the way. It's a long road. And I would say that most of us are quite surprised about breast cancer from the perspective that whereas it's extremely frightening to be introduced to it when it affects your family, I was frozen when I first learned about it. I heard about it on the phone. I drove over to the lab to see the slides myself, and my wife said I was more scared than she's ever seen me in my life, or her life. And as we went down the road of the treatment and talking to her treating doctors, we became much more comfortable with the plan that was developed and how it's all worked out. We're now 7 years later, and we're very pleased.